All right, so I think we'll get started. Welcome everyone to the webinar, Sexual Health Education in Canada, Insights from Youth Across the Country. My name is Rachel McLean and I use she, her pronouns. And I'm super excited to have so many folks join from across the country today and to present alongside my two colleagues, Shireen Noble and Erin Laverty. So before we begin today, we do want to first acknowledge that CPHA's office is located on the original unceded territory of the Algonquin Anishinaabe people. They have been guardians of this land for millennia, and CPHA and myself and the other presenters are very grateful for the example their stewardship provides. So hopefully you're all hearing me at this point. If you are having trouble hearing or if the sound is a little bit off, there is the option to call in using the number that would have been provided on the calendar invite. Due to the large number of participants, everybody is muted today. We do, however, hope that this is going to be, an interactive and an engaging session. And so we do encourage you to use both the chat feature and the Q&A feature. If you are joining from a computer, those can both be found in the toolbar at the bottom of your screens. So if you have general comments to share, please post them in the chat box throughout the session. That will be visible to all participants. You can also choose to send a direct message to myself and the other presenters. So there's just a little drop down in the chat box where you can choose to either send your message to all participants or sorry, all panelists or to participants and panelists. If you need any help in terms of connecting or with audio, you can also let us know via the chat and we'll do our best to help get you sorted out. So if you have questions for us throughout the presentation, please post them in the Q&A box, which, as I said, can be found at the bottom of your screens. Your questions will be visible to all participants, and you can post them at any time throughout the webinar. We do hope to set aside the last 10 to 15 minutes of today's session to answer your questions. And then lastly, just to let you know, the session is being recorded, and we will be putting the recording on CPHA's YouTube channel. We'll also be sharing the link to the recording with all of the registrants from today, and we'll also be sharing the PowerPoint slides. So I'm going to leave this text on the screen just for a few moments in the event that anyone is having trouble hearing me. Hopefully they can get things sorted out with the help from the text on the screen. For everyone else, would you mind maybe just giving me a thumbs up or this is great. I see lots of folks can hear me, and I see some folks are joining from Budapest and Hungary. So if you can hear me okay, maybe just give us a thumbs up, a smiley face, or just say hi in the chat. All right. Love to see so many smiley faces. Okay. So we are going to do just a quick poll because we are super interested in terms of who's joining today. So I'm just going to launch a poll on your screens. So if you're joining from a computer today, it should show up. Just take a minute to let us know, what is your professional role? Okay, it looks like most people have voted. I'll just give it a few more seconds there. I see somebody is joining from the chat as a sexual health educator. That's great. I'm sure you're among friends today. Okay. So this is really great to see. Hopefully you can all see the results. It looks like we've got quite a nice breakdown in terms of folks' professional expertise. We have some frontline healthcare providers, as well as some frontline social service providers, some educators, some teachers, lots of health promoters and program planners, quite a few researchers as well, and then some folks working in policy and in management. So welcome to everyone. It's so exciting to see such a diverse audience today. So we are going to be talking to you today about some research that was done with youth in Canada to explore their thoughts and experiences related to sexual health education. This work was done as part of a joint project between the Canadian Public Health Association and the Centre for Sexuality, which is based out of Calgary, Alberta. So I'm going to share a very high-level overview of this project for those of you that might be interested in the broader work that we're doing, and also to give you a better sense in terms of the ways in which our research findings are helping inform the work that we're doing with the Centre for Sexuality. So with funding from the Public Health Agency of Canada, our project really focuses on adapting the Centre for Sexuality's existing relationship and sexual health education program and collaborating with various organizations from across the country to support their delivery and evaluation of the program, specifically as an intervention for youth dating violence. So in 2019, we launched a call for proposals for organizations that were interested in working with us on this project. And through this process, we identified 4 partner organizations. So we have 2 partner organizations in Ontario, and I see a few names that I recognize. So that's really exciting to have some of our partner groups joining today. So we have 2 in Ontario, 1 partner organization in Manitoba, and 1 partner organization in Yukon. So with support and training from both CPHA and the Centre for Sexuality, these 4 organizations will be delivering and evaluating the relationship and sexual health education program to youth in both school and community-based settings in their respective regions in the new year. We will actually be launching another call for proposals in a few months' time. So if you're interested in possibly working with us to deliver the relationship and sexual health education program in schools or community-based settings in your own region, please do stay tuned for that call for proposals. I'll also provide an email address that you can use to get in touch with us if you'd like more information about the project or about that upcoming call for proposals. So the findings that we're going to be sharing today are currently helping inform some adaptations that are being made to the Centre for Sexuality's relationship and sexual health education program that will be delivered and evaluated as part of this project. And they're also going to be used to inform the delivery and evaluation of the program as an intervention for youth dating violence by our 4 community collaborators in their respective regions. So we're going to move into a discussion of the research that was done by CPHA in an attempt to understand the experiences of youth in Canada in terms of their sexual health education. So there is, of course, a lot of research in this area, and I would guess that a lot of the folks joining today are involved in that research, and so that's really exciting. And for our project, though, we really wanted to hear from youth in Canada that were in middle school or high school at the time of the study, or that had recently graduated, just to make sure that the data we were gathering was relevant to the current Canadian context. So as I've mentioned, we're going to be sharing some findings from an online survey and a series of focus groups that were done with youth in Canada throughout 2019 in order to explore their thoughts and experiences related to sexual health education. So with respect to the focus groups, there were a total of 12 focus groups done, half of which were done in schools and the other half of which were done in community organizations. So youth between the ages of 12 to 19 were invited to participate in the focus groups through teachers, principals, counselors, or staff at the participating schools or community organizations. And each focus group was roughly 1 hour in length, and it was conducted by a member of CPHA's research team using a semi-structured interview guide. The interview guide itself included open-ended questions about sexual health education and the experiences of the youth participants. And before participating in the focus groups, each youth was provided with a consent form, and they were also asked to complete a short demographic survey. And then in terms of the online survey, we weren't able to collect parental permission to complete the survey, so our samples were limited to those 16 to 25 or 18 to 25 in Quebec. The survey was advertised on both Facebook and Instagram, and we also asked our project partners to share some information about the project through their respective communication channels. So the survey itself was comprised of various self-report questions. So this included both open-ended and closed-ended questions focused on youth experiences and opinions related to sexual health education. And there were also a number of questions focused on youth attitudes, values, and experiences related to sex, sexual activity, sexual health, relationships, and dating violence.
Great. Thank you so much, Rachel. So like Rachel said, I'm Shireen Noble, and I'm really excited to have you here. My pronouns are she and her. And let's jump right into it with talking a bit about who the youth were who participated in our research. So this slide here is just a quick snapshot of our study samples. We're happy to provide more information if there's something you'd like to know more about. But here's the quick overview. The majority of participants in the focus groups did identify as heterosexual, but it was a much lower percentage than we might expect to see in the general population. 52% of the participants identified as female and 35% identified as male, with 13% identifying as what we've titled here transgender, non-conforming, non-binary plus category. This is just done in recognition that we don't have enough space on the slide to be able to talk about the diversity of gender identities out there. We were thrilled to see this kind of diversity among our samples in a field where we usually see a very highly overrepresented female samples. One major limitation of the focus groups is that we weren't able to get much representation from the East Coast. If you'll remember, there were the hurricanes last year that put people out of school for quite a while, and from northern communities. Although there was a good representation of different races, we did see a majority of participants identifying as Caucasian. And we were able to conduct focus groups in 4 different provinces: Alberta, BC, Ontario, and Quebec. For the online survey, as Rachel mentioned, we weren't able to collect parental permission in order to complete the survey. So our samples were limited to 18 to 25-year-olds or 16 to 25-year-olds or 18 to 25-year-olds in Quebec. We've limited our analyses here today to the participants who were 16 to 19 during the period of the survey, though, in order to try and highlight the experiences of youth who are currently or who have recently been in high school. Once again, we ended up with that overrepresentation of female identified participants in the sample, which represented almost 65% of our total sample. 21% identified as male, and and 14% identified as our diverse gender category. You can also see that we had a really interesting breakdown of sexual orientations as, you know, less than the majority identified as heterosexual. This may be a reflection of the type of people who are interested in participating in research about sexuality and sex education, or maybe a reflection on some changing demographics. Although it was fantastic to get some of these responses, like all of these responses, we also want to be transparent about the fact that 75% of our survey participants identified as Caucasian or white, and we had serious overrepresentation from Alberta, British Columbia, and Ontario, which represented about 70% of our sample. We also had almost no representation from the North, partly due to limitations when trying to advertise to a geographic location and what Facebook is willing to allow you to target as your population.
Okay, thanks, Shireen. So we're going to do a quick poll. So I'm going to launch a poll here. Just give me a second. So we want you to think, just take a minute to reflect on the question on your screen. What percentage of youth ages 16 and 19 in Canada have ever been in a romantic and/or sexual relationship? So I'll give you a few seconds to respond, and then we'll share the results and see how that compared to what we found in our sample. Looks like most folks have responded. I'll give you the final 2 seconds. Okay, so we'll share the results. So it looks like most of you joining today, 45% felt that probably 61 to 80% of youth have been in a romantic and or sexual relationship. 11% guessing that it's somewhere between 81 to 100%, and 30% guessing somewhere between 41 to 60. So I would say your responses are fairly accurate in terms of what we found. As part of our research, as part of both the focus group and the online survey, we asked youth to identify whether they had ever been in a romantic and or a sexual relationship. And so what we found was that 80% of our focus groups participants had ever been in a relationship, and 40% were in a relationship at the time of the study. We also found very similarly that 75% of our online survey sample had ever been in a relationship, and that 60% were currently in a relationship at the time of the study. So very simply put, a large majority of the youth in our sample are participating in relationships. And I think these findings will come as no surprise, to anyone that's either working with youth or working in sexual health. But we did want to highlight to emphasize the relevance and the importance of sexual health education for youth in Canada, given that they are participating in romantic and or sexual relationships. So just in the spirit of time, we're not going to do this as a poll, but I'm going to give you just a few seconds as I'm talking. Take a minute to think about what percentage of youth ages 16 to 19 in Canada have ever engaged in oral sex, anal sex, what percentage of youth have ever sent a sexual or naked picture, and what percentage of youth have ever engaged in penis or vagina sex. Okay. So what we found was that a large percentage or a large proportion of our sample aged between the ages of 16 to 19 had participated in sexual activity and related behaviors. So specifically, we found that 59% had engaged in oral sex at least once, 16% in anal sex, 47% of our sample had sent a sexual or naked picture, and 48% had engaged in penis-vagina sex. So as part of our online survey, youth were asked about other types of sexual activities. So this is by no means an exhaustive list in terms of the behaviors that the youth in our sample were engaged in. We chose just to share a few just in the spirit of time because we only have just over an hour with you folks today. But certainly we're happy to share the full report or more data in terms of some of the sex and related behaviors that youth are engaged in. We did want to share this information to highlight that a large proportion of the youth in our sample are engaging in sexual activity and related behaviors. And I think similar to the last slide focused on relationships, this will come as no surprise to those that are working with youth or perhaps are living with youth or working in sexual health. But it does serve as an important reminder that youth need access to timely and relevant sexual health education. It also serves as a very important reminder that youth are engaging in different types of sexual activity and related behaviors, and therefore that their sexual health education needs to be reflective of this diversity. Unfortunately, however, there's a lot of research that shows that the emphasis is often on penis-vagina sex within sexual health education, and certainly we did find this within our sample as well, and we will touch on that later. And this, of course, represents a missed opportunity in terms of being able to provide information and support to youth, and also could serve to alienate the many youth who are engaging in different types of sexual activity.
Thank you. So next up, we decided, due to the nature of the study of the project, to talk a little bit about the dating violence that youth may be experiencing. In order to do this, we conceptualized abuse as emotional, physical, or sexual abuse experienced by youth at the hands of a sexual or romantic partner. So for our first question, we asked about physical abuse specifically. Could we go to the next slide? Thank you. So we were able to see that 93% of the participants in the last 12 months reported that they had not experienced violence from a romantic or sexual partner. Conversely, that means that 7% of participants have experienced this. And if you take a look at this breakdown, the majority of those who are experiencing dating violence have experienced it on more than one occasion. Next up, we asked a very similar question, specifically about sexual abuse. And we saw that in this case, it was a lower proportion. It was 81% of participants reported that they had not experienced sexual abuse with a romantic or sexual partner in the past year. Again, that means 19% have experienced it in the past year. And as we saw with the physical violence, the majority of these who are experiencing sexual violence have experienced it on more than one occasion. Then what we wanted to do was take a look at the overall snapshot of have youth ever experienced any type of relationship violence, any type of dating violence, which was emotional, physical, and sexual abuse in a romantic or sexual relationship. And we saw a full 1/3 reported that they have experienced abuse. When we drilled down a little bit, we found that 14% of all respondents said that they had been in an abusive relationship in the past year. We wanted to know a little bit more about this and how youth are dealing with experiencing violence in their relationships. So we had a select all that apply list. And we found that 62% of youth who had been in an abusive relationship in the past year had received emotional support. 33% had received some kind of professional support, like counseling or hotlines. 7% had received legal support, which we broadly defined as police or social services. 76% of the youth who reported having experienced abuse in the past year reported that they left the relationship or made efforts to distance themselves from the relationship. And 1% of the youth in these relationships did not report it to anyone. So we can see that this is definitely an issue that needs some additional attention and support from programs like the Relationship and Sexual Health program.
So thanks, Rachel and Shireen. Hi, everyone. My name is Erin. My pronouns are she, her, and I'm going to talk to you folks a little bit about what youth told us about their sexual health education experiences and preferences. So hopefully now we have a good sense of the population we spoke to with regards to their sex and related behaviors and experiences. And now we're going to get a sense of their experiences with sexual health education. Okay, so on the next slide, so we asked youth about how many of them had a sexual health education experience, and we asked youth to report how many had at least one sex education lesson or workshop. And as you can see, the vast majority, so 93% of survey respondents reported yes. So sex education is a pretty common experience for the youth in our online survey. With regards to where they received their education, most reported that they received it in school. We also asked how many times youth reported receiving their sex education lesson or class. So you can see that 40% reported a few. So although on the previous slide, we saw that it's pretty widespread and common for the youth we spoke to have had access to a sexual health education program, this doesn't necessarily mean that the amount of the different lessons and education experiences were consistent among all of the youth, with some reporting receiving more lessons and workshops than others. We're also seeing here evidence that it's not super common for the youth in our sample to report receiving many sessions. So about 22% reported that they received over 7. In addition to that quick picture of the sexual health education experiences of youth, we wanted to get a sense of what those experiences were like for the youth attending those workshop or classes, particularly with regards to if they felt comfortable or opportunities to ask questions. So as you can see here on the slide, I've listed 4 of the items that we asked youth to tell us whether or not they agreed or disagreed with this statement with regards to their learning experiences. So I'll point out one of the items. The person who taught me was open and receptive to any questions. 63% of our participants in the survey said that they agreed or strongly agreed with this statement. I also will point you to the very last one. 27% of our respondents told us that they agreed that they felt comfortable asking questions. So I'll just give you a moment to look at these 4 items and the percentage of agreement with these items. Now moving on to the next slide, I want to take this opportunity to kind of get your feedback. I'm wondering if folks in the audience can let me know if these findings surprise you. So are these percentages what you would expect? If they do surprise you, what about them is the most surprising? Anything in particular, and your reasons for why. So I'll give you a moment to read them again and just to absorb that information, and we'll take a look at the chat and see what everyone's saying. I see there's some other conversations going on in the chat. So okay, here we go. Not surprised, but unfortunately that is that they do not feel more comfortable asking questions. Not surprised, however, to see that only 27%. Disappointingly low. It's true. And that's agree or strongly disagree, which means a large percentage did not feel comfortable asking questions. Surprisingly, often now we are receiving so much interesting comments. The level of openness to diverse sexual orientations makes it so asking those orientation specific questions do not seem welcoming. Yeah, so there's definitely, we're getting a snapshot of levels of comfort, and I think there's definitely an interesting and important conversation behind why the levels of comfort for asking questions might be so low. And I think it's interesting also to point out just the difference between the 63 and the 27%. So many youth maybe felt that the educator was open and receptive to questions, but maybe not necessarily they felt comfortable asking questions for various other different reasons. So there's definitely a lot to think about there, and I'm looking forward to reading everyone's comments at the end of the webinar, but maybe I'll move on to the next slide just for the sake of time. So that was a little glimpse into the sexual health education experiences and what youth told us about that. We also wanted to hear from them a little bit more about their preferences, so what they want out of their sexual health education. So we asked youth where they would like to receive their sexual health education, as well as from whom. So most youth reported that they wanted to learn in school, and which was what we found to be the most common place where they did report they learned. And most reported that they wanted to learn from a sexual health education professional or a nurse or healthcare provider. And these findings are really interesting and important, but similar to the slide before, I think it's also important to think about why they might report this. And just as some examples, I've borrowed some quotes from focus groups to start thinking about that, but it's certainly something worth exploring further. So something to think about with school, it might have to do with access. So some of the focus group participants talk about the importance of having it as a requirement in schools, and the importance of access, given that many youth of this age are in school. With regards to who youth wanted to learn from, they often in the different focus group conversations would talk about the characteristics of that person. So as sex education professional, they often spoke about how it was important for them to feel like that person had a level of expertise or a lot of information about the subject matter, and as well as the importance of a person who made them comfortable. So in addition to those type of preferences, we also asked youth about the topics they wanted to learn about as part of their sexual health education. And before Shireen speaks a little bit to the data on that, I'm curious to know from all of you with regards to what you think the topics youth would want to learn about. So just as a reminder, we're asking what you think youth reported were the topics. So that might be the same as what you think youth should learn about or what you would like to have learned about, but what do you think we heard from youth? So there should be a poll appearing now, and there's a list of options, and please select all that apply. But certainly if there's anything that's not on the list, please feel free to add that to the chat, or if you have any other thoughts or comments, if you think they would want to learn about nothing in the list. I see some comments, pleasure and body function. Pleasure's coming up again. Media literacy, engagement with porn, social media. Logistics of sex with folks of different genders. That's an interesting and good point, because we definitely have the sexuality and diversity and sexual orientation, but also how that overlaps with some other materials. So I have a question in the chat. Did you notice any difference in youth that attend public school versus secondary school and Catholic boards for preferences of who they want to learn sexual education from? We didn't perform that analysis, so I can't say for sure whether or not there were any differences. I can't give you a yes or a no to that. Sexting, how to be safe with online sexual encounters. That's a really good point, particularly looking at the data that we presented before with half of youth reporting that this was something they had engaged in. Okay. So I hope everyone can see the responses. So the most common selected option that comes up is sexuality, diversity, and or sexual orientation, 77%. But it also looks like we have like more than half being selected. Sexual pleasure comes up a lot, communication, talking about sex. Okay, these are interesting responses. I'll maybe pass it on to Shireen to let you know what we did hear from youth.
Thanks so much, Erin. So what we did was we gave all participants, regardless of whether they reported that they had received sex education or not, a list of these different topics. It was a list that had already been provided elsewhere. And so we, sorry, chat's popping up. So we'd gone with this previously established list, but we also gave them an other option. So we did get some responses that weren't necessarily reflected on this list. So we wanted to know about which of the topics did you actually learn about? And also, which of the topics do you want to learn more about? So if we can move on to the next slide. Thank you. So let's break this down a little bit. What I'm going to do is show you the topics in the first column. And then in the yes column, we'll be showing you those who reported that yes, they did learn about this in their sexual health education class. And beside that, it will be the number of those folks who are interested in still learning more about that topic. In the fourth column, we have those folks who say that no, they did not receive information on this topic in their sexual health education. And in the final column, we'll be talking about which of those students report that they have not learned about that subject, but would like to. So when we take a look at those who'd reported learning about certain topics that they still wanted to learn more about, we see an interesting pattern. With the exception of HIV and AIDS, those who reported learning about certain topics still wanted to learn more about it. So that might be an indication that while sex education is happening, it may not be happening to answer enough to answer all the questions that youth are experiencing. Next, we took a look at those who hadn't learned about a topic. We could go to the next slide. Thank you. So what's really interesting here is that among the participants who haven't learned about a topic, they really want to learn more about that topic. Across the board, about 75% of participants who didn't learn about particular topics were interested in learning more about it, even topics like STIs, puberty, and anatomy, things like that. The topics that you would generally expect to be covered in sexual health education. This suggests that there's a definite desire among those who aren't receiving sexual health education to receive more. Overall, it seems that youth are interested in learning more, whether or not they've already experienced learning about this topic. So if we take a look at, some of the stereotypes we have in the media that may exist about youth being unengaged or uninterested in what's going on, it would seem as though they are actually interested in learning more in their sexual health education. Next, we took a look at the subjects that are most commonly covered in sexual health education classes. And we can see that the subjects related to STIs, birth control, and puberty are at the top. This may be related to a traditional view of a sexual health class that provides some of the basic reproductive biology lessons that have traditionally been associated with sexual health classes. On the other hand, if you take a look at topics that have a little less to do with the sexual health aspect, on the next slide, these topics that are no less important to youth when it comes to developing healthy relationships and getting a balanced view of sex and sexuality, these are the topics that aren't often talked about. The topics like sexuality and diversity, healthy relationships, and pleasure are definitely less commonly discussed in sex education. While perhaps this isn't too surprising to you folks who are attending that sexual pleasure is rarely discussed in sexual health education, if you take a look at your results from the poll that was done earlier, the most common topic that you thought youth wanted to learn about was sexuality, diversity, and sexual orientation. So topics like sexual diversity, like healthy relationships, topics that need to be discussed openly and normalized, unfortunately are left out of many youth's educational experiences. We'll talk a little bit more about this in the next a few slides. Now, we'd like to get you to reflect back a little bit on your own selves in high school. So what we did in the online survey was we asked a question of youth, and we'd love for you to take a minute to think about it as well. What advice would you give your younger self when you were in high school? Or to put it another way, what do you know now that you wish you knew back in high school? If you're comfortable with it, please feel free to share your reflections in the chat box, but if not, that's fine. We've got a question here about what do we mean by sexuality and diversity? There we're talking about primarily things like sexual orientation and gender identity. there was a bit of a desire from students who reported, you know, learning about sex from a very religious bent, that they wanted to learn more about the diversity of opinions rather than just what perhaps their Catholic school was teaching. But for the most part, diversity was generally talking about sexual orientation and gender identity. So we have some really fantastic responses coming in here. Someone's saying how to orgasm earlier in my life. Someone said, take some more time to explore and figure out who you are and what you like. That it's normal and okay for cis women not to orgasm during penile, vaginal, or intercourse. That you can talk about sex and masturbation with your friends. Many of them are thinking about it too, and it's okay to chat about. Wanting to have sex, masturbate, experiment is normal. There's so much diversity when it comes to gender and sexuality. If I'd heard about trans, non-binary, queer people sooner, it would have helped me a lot. Would have liked to know that all bodies look different and that's okay. Also, that my pleasure matters too, not just my partner's. Wish it was more inclusive. As a queer youth in a rural community, I felt excluded from conversations. Then consent is coming up. Consent's a huge one. There are so many fantastic points coming in here, but for the purposes of time, I'm going to move forward and share with you a couple of quotes that are very much in line with what you're talking about. Some of the messages that youth wanted to know earlier is that masturbation is okay. It's okay to like girls. Sexual violence isn't normal and you don't deserve it. So that definitely gets back into those of you who are talking about the importance of consent. The importance of talking about diversity, sexual orientation, gender identity, to know that, you know, it's okay to be who you are. Things like that that weren't necessarily covered in their health classes. So what we can see in these messages tie back to what the youth reported not learning about in school. Lessons around consent, sexuality, healthy relationships, and, you know, the variety of activities and behaviors that can make up what it means to have sex rather than this focus on penis and vagina sex are all mentioned here by online survey participants.
Thanks, Shireen, and definitely thank you to everyone that's you know, taking the time to share in the chat. It's always great to hear from folks. So we're going to spend a little bit of time moving into a discussion of some of the key themes that emerge from both the online survey as well as the focus groups that were done. So one of the key themes is that we found, and again, not surprisingly, that youth truly value sexual health education. They see it as important and essential due to the significant impacts that the lessons they learn can have both on themselves and on their peers. So we're going to share some quotes that these two quotes are both taken from focus group participants. And they really highlight the ways in which youth value sexual health education and sort of the reasons behind why they find it so important. One focus group participant shared, "I know that I probably wouldn't have known all this stuff that I do now, and it will probably become important in the future. That's why I believe it's important." So I think this really speaks to the need for timely and relevant information, and that can help you know, youth throughout the course of their lives. Another participant shared, "I think it's really vital to our mental well-being and general and physical health. Like, it is very important, and I think it should be prioritized." So many other youth in our both focus group and online survey sample similarly spoke about the merits of sexual health education for their social, emotional, and mental well-being. And so what we found is that youth understand, perhaps better than, you know, sometimes the adults who are involved in sexual health education, they understand that the value of sexual health education extends beyond their physical health. And this, of course, is in line with a more holistic understanding of sexual health and well-being. And so when talking about the value of sexual health education, many youth spoke about the importance of learning about both healthy and unhealthy relationships. And this is perhaps not surprising when we consider that healthy relationships was one of the topic areas that youth most commonly reported wanting to know more about, but also one of the areas where they didn't often receive much instruction. And so this also builds on what I shared during the last slide. Youth understand that sexual health education needs to extend beyond a sole focus on the biological or physical aspects of sex and sexuality, and encompass a broader range of topics that support their mental, social, and emotional well-being as well. So I'm going to share two more quotes because I think, youth can speak to, how this impacts their lives better than we as researchers ever could, of course. Many youth spoke about the need to learn more about healthy and unhealthy relationships as a means of harm prevention, both for themselves and for their peers. So as one participant in a focus group stated, "I knew jack shit about healthy relationships and stuff like that. I learned nothing about it. And stuff like that in school, and I learned nothing about it. I ended up in my first relationship and it was extremely abusive and I had no clue it was extremely abusive." And so I think certainly this sort of ties back to some of the sentiments that were shared by you folks in the chat and also some of the quotes that were shared earlier by Shireen. Another participant shared, "In schools, students need to be taught more about abusive relationships and how to deal with them and get out of those situations." So from these quotes, and certainly from many of the other stories that were shared by our youth participants, it's evident that youth often found themselves or they witnessed their friends struggling to navigate romantic or sexual relationships without a basic understanding of some of the characteristics of both healthy and unhealthy relationships, and also without a basic foundation in terms of some of the skills needed to participate in healthy relationships. So that could include, for example, the ability to communicate their needs or the ability to set boundaries within relationships.
Okay, thanks, Rachel. So the second key finding from our studies that we want to share with you today is with regards to the indirect and implicit messages received, and the importance of recognizing bias and social influences in learning experiences. So their learning experiences are influenced not only by what information is shared, but also by how that information is shared. How information is shared, often through indirect or implicit messaging, really influences youth learning experiences, and it can at times serve to perpetuate stigma and impact their understanding of what is considered normal in the context of sexuality and relationships. So I think the quotes will really help illustrate what we mean here. On the right here, one quote from a participant, "And the adult in the room is the authority and giving the information. So the way that they're presenting it is very much informs the way you feel about it." So youth often would talk about the tone of the educator or picking up on maybe some biases. And the quote on the left here, just the end of a quote, we see, "We were basically being told we shouldn't be ready for sex." So I'll explain a little bit more about where this quote came from. So this particular participant was sharing their reflections of the implicit messages that they received through a particular homework assignment in their sexual health education class. So they were reflecting back on their gym class where they received their sexual health education and received this homework assignment that involved, they were asked by the educator to write a letter to a hypothetical boyfriend. And the purpose of the letter was to express refusal or disinterest in having sex with that hypothetical boyfriend. So this focus group participant spoke about how, in addition to identifying the heteronormative bias and the feeling of being excluded as someone who self-identified as a lesbian, they also spoke about how there was this subtle message that we were basically being told that we shouldn't be ready for sex. So I think it was these really brilliant insights that youth were picking up on the implicit messages and how that impacted them in their learning.
Okay, thank you. Now, the next thing that we talked about, or the next thing that we found was inclusivity. So one thing the youth were very articulate about in these focus groups was the fact that inclusivity was important in their sexual health education. And this was regardless of how that participant identified. There were plenty of heterosexual, cisgendered folks that we presume to be cisgendered, that were sharing that, I'm not the person, I'm not the person who's being affected by this, but it's important that other people are learning about sexual orientation, about sexual diversity. People recognized that it was going to help everyone to know more about the diversity among them. So it is noteworthy in this case that inclusivity doesn't only extend to sexual orientation and gender identity, but it could also include things like religion, race, culture, etc. But it was primarily discussed by participants in regards to sexual orientation and gender identity, which is what these next quotes are going to focus on. So the first suggestion from our online survey participants was be more inclusive of genders and sexualities in giving the information. Often people in these groups have to turn to other sources for information. So in particular, this quote discusses the need for youth to receive information about sex, and that's about sex regardless of their orientation or their gender identity. I particularly appreciate this comment about having to go to other sources for information about sex and sexuality if they're not being covered in school. So we can talk about people going to mainstream media, we can talk about them going to friends, even going to pornography to learn about the, pardon the pun, but the ins and outs of sex. With the second quote, it says, I was born intersex and I learned literally nothing about it in school. And you can see here that sex education doesn't often think about gender identities beyond male and female. This is particularly an issue in cases like students who are born intersex or participants who may identify as trans or gender nonconforming or non-binary, because they're literally not learning about their bodies and seeing themselves represented in their classes.
Thanks, Shireen. So this fourth theme really speaks to the importance of providing youth with access to balanced information that highlights both, the positive aspects of sexuality and relationships. So things like sexual pleasure, talking about the positives of being involved in a sexual or romantic relationship, and balancing that with, this emphasis on the prevention of possible negative outcomes. And this is, of course, this balance piece has not always been the case in sexual health education. And even today, I mean, these youth, we're talking about very recent experiences. So even today, we see that fear-based and negative messaging are still very prevalent, unfortunately. So what we heard from youth was that when they were provided with balanced information, that didn't necessarily dictate what they should or shouldn't do in terms of sex, sexuality, and relationships. They were better equipped to make informed decisions that were right for them at that time. And I think this really relates back to the quote that Erin shared too about the homework assignment, where that youth was being told some very explicit details about the decisions they should make when it comes to sexual activity. But we have to trust youth and know that they are mature enough to be provided with different options and to make decisions that are right for them at that time in their lives. So I'm going to share some quotes, and I think these two quotes really help sort of drive home the point in terms of why youth need access to balanced information. So focus group participant, the quote on the left of your screen: "We don't want situations like the teacher in the movie Mean Girls who taught, don't have sex because you will get pregnant and die." So I'm sure there are some folks on the line, or at least I hope, that have seen Mean Girls. But I mean, whether or not you've seen the movie Mean Girls, I mean, I think this quote is really just a pushback against the traditional way of providing sexual health education, where, talking about the extremes and where fear-based and negative messaging is sort of the norm. Another participant from the online survey shared, "List out all options and give out the pros and cons of each option." And so this quote, of course, speaks to youth's desire to learn about the potential benefits and also the potential, negative outcomes associated with different choices, and then to be able to make an informed decisions that's really right for them and for their bodies.
Thanks, Rachel. The fifth point theme that we found was that youth want some kind of balanced approach from their sexual health educators in their facilitation or their delivery approach. So youth appreciated it when educators are personal, engaging, comfortable, and approachable, while still maintaining a certain level of structure within the classroom and a certain level of professionalism. So let's talk a little bit about what that might look like. One of the online survey participants suggested, try to be approachable without pushing it too hard or trying to be too relatable to the youth. It's a fine balance, but don't try to push people to come up to you or open up to you. So they know you're not a youth. They don't expect the educator at the front of the room to be exactly like them. And they do appreciate it if you're not pushing them too hard. Another online survey participant said, be casual while being professional. If we learn from an educator who is comfortable discussing these topics, we'll feel more comfortable talking about it. So if we think back to the theme about learning about from the implicit messages, how things are said, what things are said, if you have a teacher or a facilitator at the front of the class who's demonstrating to the students, I'm uncomfortable talking about this. This is something weird. That's definitely going to be conveyed to the participants in that class. So it's really important to be comfortable with the topic area, but it's also extremely important, like the previous slide said, to be professional, to be kind, to be open, and to be respectful with your students. And that's where they're going to get the most learning out of what you have to offer.
So our sixth and final key finding from and theme from our studies that we want to share is about ongoing opportunities to learn and access to resources. So youth expressed this desire for more opportunities to participate in sexual health education. They wanted to learn more. This included receiving formal sexual health education over a longer period of time, so across different years, as well as more opportunities to learn about the different resources and services available to them in the community for various different needs. So a couple of quotes. So on the left, we see here, online survey participant, make sexual health its own class, not just 2 weeks of gym class. And on the right, focus group participant, speaking about how some people don't know about different resources. So quoted, honestly, some people don't even know to go to the clinic. Like, we're not really informed about that unless we have a problem and we speak to a counselor that directs us to the clinic. So youth really talked about how they wish they knew about all these different resources and services that were relevant, and as well as that being important to their peers. And so we happen to agree with the youth on this, that it's important to have opportunities for ongoing learning and access to different resources. So here on the slide, and the slide will be available to folks afterwards, we've listed a few excellent resources. So certainly there are so many additional excellent resources out there, but here's a few to start, and I encourage you to take a look at them. I'll just point out that some of the resources are more focused on information that would be used to provide to youth, so like Sex and You, and others are probably more applicable to educators or policymakers. Okay, so as a whole, what have we learned and what have we shared today? So firstly, providing sexual health education is important. I think hopefully everyone came to this webinar with that in mind, but we're definitely hearing that today. But also, important are the nuances in terms of how and where this information is delivered, by whom and in which settings. Additionally, our findings show that youth have important insights on sexual health education in Canada, and that their perspectives need to be prioritized when considering changes to the curricula and delivery processes. So I thought it was really interesting to hear, like, youth have a lot to say and their insights are clearly very valuable. And quickly wanted to say thank you to our financial support, the Public Health Agency for funding this project, our community partner, the Center for Sexuality, who we work with on this project, who have reviewed some of our data collection tools, for the logistical support, so the staff at schools and community organizations who volunteer their time and efforts to help set up the focus groups. Their help was absolutely appreciated. And of course, importantly, the study participants, the youth who attended the focus groups and the online survey, who have provided us with an opportunity to learn from them and their experiences. And thank you to everyone for attending.
Okay, so thanks everyone for sticking it out to the end. We had scheduled this until 2:15, but I imagine that some of you may need to duck out. So we're going to spend the next 10 or 15 minutes just setting aside some time for questions and answers. So at this time, I do invite you to put your questions either into the chat or into the Q&A feature, which again is found, if you're on a computer, is found at the bottom of the toolbar in your screen. So while you're taking a few minutes to type out your questions, I do want to remind you that we will be seeking applications for more collaborators, and those partners, of course, are going to be involved in actually delivering and evaluating the relationship and sexual health education program in their own communities in the new year. So we'll be seeking out, we'll be launching a call for proposals in the new year. So keep your eye out for that. I've included our project email. So definitely get in touch with us if you want to learn more about some of the data that we shared today or learn more about our project and the call for proposals. We are always happy to receive more emails about the project and to connect with folks from across the country. I also want to flag that when you exit the webinar today, you will be redirected to an anonymous evaluation survey. This is we're in the earlier stages of this project. We're getting ready to actually begin delivering and evaluating the relationship and sexual health education program. So your feedback is very important to us. So please do take a few minutes to complete that survey. And lastly, just a reminder that we will send the slides and a link to the recording. I noticed in the chat there was a question about potentially including the links to those resources. So we can also include that in the follow-up email that we send in the next week or so with the slides and the recording. So with that,